Is Dr. Rahul here? Yeah, so next talk is again on muscle transplantation. I think it's become a hot topic. I guess it's that side. Yeah. Yeah, so now this is exotropia. So the role of muscle transplantation case series in large angle comitant alternate exotropias.
Good morning, respected faculty and friends. I'm Dr. Rahul and my guide is Dr. Aman sir. My topic is true muscle transplantation surgery in a case series of concomitant large angle alternate exotropia. So it is a condition that presents with large, more than 75 to 90 prism diopters of deviation in both eyes alternatively. Large angle exotropia poses a lot of challenges in management due to high rates of recurrence and surgeries of multiple muscles is required to gain the alignment. Up to 50 to 60 prism diopters, it's comparative, we have less complications, but larger deviations pose a lot of challenges. So more than usually two eyes and more than two muscles are taken up for surgical correction, that is 3 or 4 muscles. So in the event of recurrences, less number of muscles are spared and larger maximal recessions or resections are associated with complications of lid lengthening and palpable fissure height changes. So to obviate the need for this second surgery, we can address this problem with this single eye surgery. So the transplanted part in this surgery acts as a biological spacer and the ocular motility is not compromised. So the purpose is to report in a case series of 25 patients with large angle concomitant alternate exotropia, more than 75 prisms corrected by this surgery. So all age group patients presenting with 75 or more prism diopters were included. Comprehensive ophthalmic and orthoptic evaluation was undertaken. Pre-operative evaluation, post-op evaluation on day 1, 7, 1 month and 6 months was undertaken. And most importantly, orthotropia is said to be achieved if less than 10 prism diopters of exo or ESO deviation is present after surgery. So in this procedure, the lateral rectus muscle is initially hooked and isolated, followed by the medial rectus. As you can see in this photograph, the medial rectus muscle is resected and later it is recessed near or transplanted near the lateral rectus. These are the intraoperative photographs. So my first case, an 8-year-old female child, she presented with outward deviation in right eye, best corrected visual acuity 6/9 in both eyes, some compensatory head posture was present. HCRT was 30 exo in right eye and PBCT was 75 prism diopters in both eyes. Surgical procedure was undertaken in the right eye, 10.5 mm LR recession and 6.5 mm MR resection, and muscle transplantation was performed. Here are the pre-operative photos and post-op day 1 orthotropia was achieved.
I just have a question. 10.5 recession you have told is the normal recession that you planned, or along with the transplant tissue was it the effective?
Normal recession.
So normal is 10.5.
Yes, ma'am. Okay. And post-op 6 months here we have. And another case of a 14-year-old female, she presented with similar complaints in right eye and family history was present. Here the PBCT was around 75 and 80 prism diopters. Muscle transplantation was undertaken and here are the preoperative and post-op photos. Another case with 15-year-old boy, left exo deviation. Here 75 prism diopters was present and similar muscle transplantation was undertaken. You can see the preoperative photograph and ortho alignment was achieved even after 6 months. He's just come back for 1 year, he's doing fine. And this is a peculiar case, 31-year-old. He presented with on and off deviation since 15 years. He presented with paradoxical diplopia, that is uncrossed diplopia in this case of exotropias. You can see the Wirth-4 dot testing and diplopia charting here. Preoperative deviation was, you can see the large angle exo in right eye and post-op alignment was achieved. Patient is doing well even after 1 year. And my last case is a 33-year-old and he was one of the largest angle deviation we had. He had around 90 to 95 prism diopters and muscle transplantation was undertaken, but unfortunately slight undercorrection was present in this patient. You can see the post-op day 1, some palpable height changes were also present. And so out of my 25 cases in this case series, male-female ratio was almost equal and pediatric population was around 40%. None of them have landed with any complications of lid lengthening or widening except that one case of undercorrection. So in this case series of 25 patients, mean pre-op deviation was around 75 prism diopters and which was effectively corrected and mean post-op deviation came to around 5 prism diopters. P-value was found out to be around 0.05. With the help of this surgery, the effective length of the muscle could be increased and therefore results could be improved. Though there could be abduction limitation due to excessive weakening of lateral rectus, this was not seen in this study. Large recessions and resections usually induce severe restrictions and therefore incompetence even after a good primary position result. So to avoid such complications and preserve competency, we can perform this surgery. So this novel surgery has been proven to be effective and successful in correcting large angle exo deviations. Thank you.
Thank you, Dr. Rahul. So this was your thesis?
Yes, ma'am. It's part of my thesis. I've been following it up since 1.5 years.
Okay,
And
good.
patients are, as of now, until now, they're happy.
Okay.
Except this one patient we have to.
So I just want to just comment. Can you tell me what happens to the tissue once you have transplanted it?
Once you have transplanted it, since it's an autograft, ma'am, there's no, usually we don't have any rejections, first of all. And this piece acts as a biological spacer. So it helps in, it provides that.
So what happens to the tissue? Maybe after a month or 2 months or 3 months, what happens to that tissue? Okay.
Yeah.
So basically that tissue, undergoes fibrosis.
Yes, ma'am. It undergoes
and
fibrosis.
It's replaced by so it becomes a fibrous, nothing but a fibrous spacer.
Yes, ma'am.
So the muscle and all, everything is replaced by fibrous tissue. Yes. The blood vessels are obliterated.
Yes.
So important thing is it acts as a fibrous spacer.
Yes.
Another thing, did you notice what is the contraction that happens? It's because you are taking the MR, resected MR tissue.
Yes, ma'am, resected MR.
So MR already you are doing hardly 6 to 7 mm.
Yes, ma'am.
So how much contraction happens? It's not that if you cut 6, 7 mm, you will get that 6, 7 mm.
Yes, yes.
Contraction happens.
Yes, ma'am.
How much was the contraction? That you should know.
Okay, ma'am.
Because that tells you how much effective recession you are getting eventually.
Okay, ma'am.
Okay. And of course, in exo cases, the limitation is not that much, or the patient don't appreciate much as compared to ESOs because, because of course, divergence is not much of an issue than convergence. All right. Thank you, Dr.